Well, hello everyone, and thank you so much for joining us tonight for our first webinar in the Access to Medication series. I'm going to quickly introduce myself. I'm seeing some names on the call here. I recognize a lot, but I am pretty new to the organization. My name is Teresa Blondin. I'm the manager of volunteers and community programs at Bladder Cancer Canada. I'm so proud and happy to be a part of this organization. And I see there's quite a few staff and board members from Bladder Cancer Canada on the call with us tonight as well. So thank you so much for joining us. I want to give a huge thank you to the team at Eversana who have graciously provided us with these webinars and all of the planning that they've done going into these. So without any further ado, I would like to introduce the presenter for the evening. It's Clarke. He's from Eversana. He's been leading advocacy and PR at Eversana. Ryan creates and implements impactful advocacy strategies. He's trained thousands of people on how to make their voices heard. He holds a master's in political science, and he's a member of the Law Society of Ontario. He's practiced family law for 3 years, served as a policy advisor to the Ontario Minister of Energy, Science and Technology, and specialized in public policy as the senior manager at Glaxo Wellcome. So I will pass it over to him for the presentation, How Government Works in Canada and Who Does What in Canada's Healthcare System.
That's great. Thank you, Teresa. I really appreciate it and wonderful to be here tonight with all of you. I'm just going to stop my video just in the interest of saving internet, and we'll get started right now. So here's an overview of what I want to talk to you about today. We have a lot of content to get through, but we're going to talk a little bit in the first part of the presentation about essentially how government works in Canada, the rationale being that if you're going to advocate to government around any issue or engage government around any issue, it's good to have some understanding of how it works. And then we're going to talk a little bit about who does what in our publicly funded healthcare system, because again, if you're going to advocate within the context of healthcare, it's important that you have some understanding of how this all works. So moving to our first slide entitled Governments in Canada. Many of you will know a lot of this stuff, so I will go through it, as I said, quickly, but it's always good to just make sure that we remind ourselves. Canada is a federal, state, parliamentary democracy, and a constitutional monarchy. It is all three of those things. A federal state meaning that we have a central government or a federal government for national matters and separate local governments for local affairs, provinces and territories. We have a parliamentary democracy, as you all know, in which we elect members to represent us at the federal and provincial level. And then, of course, we have a constitutional monarchy headed up by the head of Canada's head of state, the Queen in this particular instance, obviously, for us. There are 3 levels of government in Canada. We have federal government, provincial and territorial governments, and municipal or local governments. Each level has its own arrangement of elected and appointed officials. But one thing that's really important to remember is that only the federal and provincial governments are enshrined in the Constitution Act of 1982. Municipal and local governments are a creation of the provinces. So let me explain what that means. And I'll use Ontario as an example, every town, every municipality, everything that's local in Ontario has been created pursuant to legislation passed by the province. If the province of Ontario decided they wanted to eliminate the city of Toronto tomorrow, they could do it. The cities and towns and municipalities are an artificial construct in the sense that they're not protected legally outside of the legislation that has created them. They can be eliminated. Elected officials at the federal level, as we all know, are called MPs or members of parliament. And at the provincial level in Ontario, they're called MPPs. But Ontario is the only province that uses the term MPP. In Quebec, members of the National Assembly, are called MNAs, members of the National Assembly. In Newfoundland, they're called members of the House of Assembly. And then in the 7 remaining provinces and 3 territories, they're called MNAs, members of the National Assembly. I don't know why all these provinces are different, with the exception of Quebec, but this is what we have here. So they're not all exactly the same. Our Constitution. It all starts with our Constitution. When you want to understand how government works, and quite frankly, how healthcare works in this country, it all starts and emanates from here. There are 3 main parts to the written component of our Constitution. There's the Constitution Act of 1982, which was repatriated from the British North America Act of 1867. And that describes the authority, parts, and functions of Parliament. We have the Charter of Rights and Freedoms, describing the basic rights and freedoms all Canadians have relative to government. Understand the Charter does not apply to what right I have relative to you as another citizen. It has only to do with what rights I have relative to the government. And then the amending formula, which we're not gonna talk about this evening. Sections 91 to 95 really set out the essence of what the federal powers are and what the provincial powers are. In the case of the division of powers, meaning what does the federal government do versus what do the provinces do, it's based on the idea of subsidiarity, meaning that the level of government closest to the issue, the government level closest to the issue governs it. In other words, the municipal government picks up your garbage, not the federal government, to give an illustration of what we're talking about in this particular case, or what that idea means. So Section 91 contains all of the federal powers, the powers of the federal government. Note that the highlighted reference is the only thing linked to healthcare under Ottawa's jurisdiction. Well, that and money, i.e. who pays for publicly funded healthcare. So if any issue that you have falls within one of these powers listed on the screen, your advocacy target must be the federal government. Now, this is notwithstanding the fact that there are some shared powers between the federal government and the provinces, and in fact, even between the feds and the provinces and the municipal governments. But in generally speaking, this is how it's divided. You'll notice this is very old language. It's language from 1867. You'll notice that it doesn't say the word healthcare or anything like that. In fact, you're not even going to see the word healthcare under the provincial powers in Section 92. Also note that all residual powers in Canada go to the federal government. It's the opposite in the United States. Any residual powers, or meaning powers that are have not yet been delineated or determined, automatically go to the states. Here, they automatically go to Ottawa. Section 92, this sets out the powers of the provinces. You'll notice that the only reference to healthcare is the one that's highlighted there. Eleemosynary are institutions that are founded by charities. That's what that word means essentially. Agriculture and immigration are concurrent powers. So again, if any of your issues fall within one of the powers that you see on the screen in front of you, your advocacy target must be the provinces, or by extension, local governments. Notice the last bullet on the right-hand side. Generally, all matters of a merely local or private nature in the province. That is the power that gives the provinces the right to create towns, municipalities, etc. So now let's turn to how the federal government itself works. We have 3 branches of government at the federal level. So we have the monarch, Queen's representative, the Governor General, who we're all familiar with, who in essence, this doesn't visually depict it, but kind of sits atop the 3 primary branches. So we have in the top right-hand corner, we have the legislative branch that is made up of the members of the House of Commons, as well as the Senate, and they create statutes under federal jurisdiction. Moving down to the bottom left, we have the executive branch, including the Prime Minister and cabinet ministers, and the executive branch sits within the legislative branch. And then we have the judicial branch, which interprets all federal laws, federal court system headed by the Supreme Court, and that sort of thing. Now, just a note that I'm not going to be talking in detail about the judicial branch in this presentation, as engagement with that branch of government is completely different. It's a completely different undertaking, you can all appreciate. And I trust we all understand that we don't advocate to the monarchy. And so that leaves your advocacy targets at the federal level within two branches, the legislative branch and the executive branch. So that's where I'm going to sort of go into some detail. Before we do, though, just a quick reminder about our electoral system. It operates under two principles: single member constituency and first past the post elections. Single member constituencies, as you all know, means that we have a bunch of constituencies or districts or ridings across the country, each represented by only one locally elected representative. That's different than other systems of government, by the way, including other democracies. First past the post refers to the rules in which a single member is elected, meaning that during an election, the candidate who wins the most votes, irrespective of whether it's a majority of the votes, wins and gets to represent those constituents under the banner of that particular riding, or the riding that, or excuse me, the party that they're a member of, if in fact they're a member of a party. The party system in the House of Commons. A political party is, in essence, just a group of people who share common beliefs and ideas about how to govern. And while there have been many different kinds of political parties, particularly at the federal level, the current composition of the parties in the House of Commons are 5 different parties. You'll all recall we have a minority government headed by the Liberals. The Conservative Party is the official opposition, and then the Bloc, the New Democrats, and the Green Party of Canada, although they have technically no party status within the House. Now, you could advocate to a party between elections, but that's not generally done except in the lead up to an election, for example, to get an issue of importance for an organization on a party's platform. What, of course, is more typical, or most typical, is advocating to individual or local MPs. And just a reminder, traditionally the Conservatives and the Bloc have been right of center parties on the political spectrum, while the other 3 have been center or left of center. So here are the results of the September 20th federal election, which are pretty close to the results from 2019, which constitutes the makeup of the current House of Commons. Shifting now to the Senate. The Senate used to be made up of Liberal and Conservative members, meaning senators who were appointed by one of the 2 parties that have formed a government in Canadian history. Remember, only those 2 parties have ever formed a government at the federal level in this country. That's all different now, as you can see from this slide, and as you'll see, basically from this slide in particular, we now have 5. I'm going to call them parties, but they're not even all parties. They're either parties or affiliations within the Senate. And just a reminder, of course, that advocating to senators is absolutely a form of engagement that can be very effective at times. Moving now into the House of Commons, most statutes originate in the cabinet, or by cabinet, those are called government bills, and are passed by the House of Commons after multiple rounds of debate and decision making. In a majority parliament, cabinet has ultimate control over the output of the legislative branch. In a minority parliament, cabinet has what we call general control over the output of the legislative branch. What we always want to remember as well, in a minority parliament, advocating to the opposition is very different than in the majority situation. In a minority situation, like we have now, the minority parties can actually influence the government's agenda. So just something important to keep in mind. Bills are typically subject to first, second, and third reading. There's a committee process as well. Then it goes to the Senate, who go through comparable first, second, and third readings, as well as committees. Then a bill gets royal assent by the Governor General, and that is how we get laws made. So statutes or acts set out the general framework and often contain the provision for regulations. I'm going to chat a bit more about this in a moment. Also remember at the federal level that bills can originate in the Senate. I'm not going to spend a lot of time on this, but there is quite a complex and robust committee structure within the legislative branch, specifically the House of Commons at the federal level. Again, can absolutely be a place where one can advocate depending on the issue that you have. You've got a comparable structure over on the Senate side as well. This is a snapshot of the Senate committees actually from the last Parliament. I'm not sure if the new ones have all been completely set yet, but they'll be generally the same. Now, when we talk about the government in everyday language, we're usually talking about the executive branch, even though earlier I mentioned that the government technically refers to all three branches, legislative, executive, and judicial. So that's why you'll hear the media say, for example, the Trudeau government, referencing the executive branch currently headed by Prime Minister Justin Trudeau. As I mentioned, the executive branch sits within the legislative branch. It consists of the cabinet and also non-political civil servants. The head of government is the Prime Minister, appointed by the Governor General. Prime Minister selects the cabinet, who are also appointed by the Governor General, and the Prime Minister and cabinet remain in power as long as they maintain the confidence of the House of Commons. Continuing on with our discussion of the legislative branch, on this slide, the people on the left, we refer to them as the political side. They are made up of people that have been elected and chosen to serve in the executive branch, along with their staffers. I was one of those staffers at the provincial level. They come and go with every election and are responsible for setting out the broad direction that the government of the day chooses to pursue. The people on the right-hand side are referred to as the bureaucratic side, or civil servants. They are made up of people who have chosen a career, oftentimes a career, working in government at various levels, often across several portfolios over the course of their work lives or the time they spend in government. The Prime Minister can't fire these people, for example. They are more permanent. They remain in place regardless of who gets elected and are responsible for implementing the overarching direction set down by the government of the day, as well as just running the day-to-day operations of the federal government. And of course, on par with advocating to individual local MPs, advocating to cabinet ministers and civil servants is one of the cornerstones of engaging governments in Canada. Turning now to laws. Laws consist of three primary components. Let me just pause here for a second in case you're wondering why in heaven's name I'm going into this much detail. And the reason is because when you are seeking to make change within government, or you're asking government to do something, it is critically important that you understand what government needs to do in order to make the change that you require. Do they need to pass a law? Do they need to amend a regulation? Do they need to create a policy? Those three things are very, very distinct and have very distinct processes attached to them. So that's why I just want to spend a moment talking about this so that I can provide a bit of clarity around this. Laws consist of three primary components: statutes or acts. Those are ones passed by the legislature, the House of Commons and the Senate. Regulations, those are passed by cabinet. And this third bucket that we typically call policies, but that can refer to other things like directives, standards, guidelines. These are developed by the bureaucracy and are used to implement in practical terms statutes and regulations. So let me give you an example of this, because I think this really helps to make clear how this all kind of works together. It's a provincial example, but it works the same federally and provincially. In Ontario, there is a statute, a law that was passed by the Ontario legislature called the Ontario Health Protection and Promotion Act. That act, that law, that statute has 19 current regulations. One of those regulations that was passed by cabinet in Ontario is called the Health the School Health Programs and Services Regulation, or just School Health Programs and Services. In that regulation, this is like a funnel. We're going down, 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 down. In the regulation, it says, in part, every Board of Health shall provide oral health promotion to elementary school pupils. That's a quote. And then in turn, each Board of Health, based on what I just read to you, would determine through their own policies how best to fulfill that requirement in their individual communities. So you see, we have statutes that are passed by the legislative branch. We have that then have regulations that are passed by cabinet that then empower, in this case, local authorities to create policies that are implemented at that particular local level. The next group of slides illustrates the parallel content we've just reviewed at the provincial level using Ontario as an example. Now, not every province operates in exactly the same way as I'm about to review, most notably some of the smaller ones, but the differences are minimal. So again, we have a monarch, representative, the lieutenant governor, legislative branch, executive branch, judicial branch, and aside from advocating to the Senate, all of the advocacy opportunities I highlighted in the federal government section hold true at the provincial level. Our electoral system at the provincial level is exactly the same as it is at the federal level in terms of the two principles that it's structured around. This is the current party distribution in Ontario that we have. You'll notice that there are a number of parties, there's some independents, only 2 parties have official status, but there are representatives from a number of different parties. There's a bunch of independents. This is the current situation in Ontario with, as a reminder, a majority government. The legislative branch in Ontario is the same as the federal system. The only difference is there's no Senate. You all know this. There's no Senate at the provincial level in any of the provinces in Canada. The legislative branch has a series of committees as well, just like at the federal level. Your MPP, if you're in Ontario, or MLA in another province, may sit on one or more of these committees unless they're a cabinet minister. The executive branch in Ontario is essentially the same as in Ottawa, except it's headed up obviously by called the Premier in Ontario. Again, everything else is basically the same. Again, largely the same as our federal executive branch in terms of the division between the folks on the left, the political folks that I talked about in some detail at the federal level, and then the bureaucracy on the right-hand side. So now let's shift to who does what in Canada's healthcare system. And we'll begin with just a quick overview of some statistics. This content is from the OECD, and it captures public and private per capita health expenditures in select countries in 2019 in US dollars. Just a reminder, these are US dollars. So you'll see that Canada comes in at around almost $5,400 US per capita, with a split of 70-30, meaning 70% of per capita health expenditures in Canada are public and 30% are private. That top stat, the one in the top left-hand corner that you see, is in Canadian dollars. So that 5,370 US converts approximately into $7,068 Canadian. So Canada spends almost $7,068 per Canadian citizen on healthcare. And for the bottom stat, it shows again the public-private split in healthcare costs is typically, again, about 70-30, as you can see, with the graphic showing that you've got government coverage, 64%, other public sources 4.8, for, again, a total of close to 70, and the remaining out-of-pocket and private insurance approximately making up about 30%. So where did each of us spend that $7,068 for our healthcare in 2019? Well, this gives you an idea of where it all goes. The big three, as they are affectionately known: hospitals, drugs, and physician costs. Hospitals making up the largest component, over 25%, 1/4. Prescription medications in particular, 13%, and physician salaries, etc., almost 15%. Those are the two, or those are the three, excuse me, large buckets that expenditures here. And finally, this slide, the provincial territorial breakdown of the 7,068, versions of which many of you may have seen over the years. The slide is very common. It's reproduced every year from High. Note the Quebec and Alberta increases. In particular, you'll see that Quebec's healthcare spending year over year was quite high, whereas Alberta's was quite low. You'll also notice the raw numbers in the territories per capita versus the rest of the provinces, with the exception of Newfoundland and Labrador, which is a bit of an outlier for the 10 provinces, but the rest of the provinces cluster relatively tightly around the $6,500 to $7,600 mark sort of thing in terms of expenditures. Now, you'll remember a few slides back, I reviewed the two parts of the Constitution Act 1982 that sets out the powers of the federal and provincial governments. But there are other parts of Section 91 and Section 92 that give the government enhanced power or influence over healthcare in Canada. So, the provinces have exclusive jurisdiction for the direct delivery of healthcare services, as we all know, in part, not just through that section that I showed you before, as I said, but through Section 92(1)(3), which is the powers over property and civil rights, and also the section over matters of merely local or private nature. Case law and others have developed over the years to further solidify that the delivery of healthcare is, by and large, exclusively the jurisdiction of the provinces. The federal government has jurisdiction over drugs and food through the criminal law power clause under Section 91, sub 27. That is a development, again, over some years, but basically the story goes like this: probably 100 years ago or longer now, someone figured out that these potions and other things that were being created for people to take to cure all of different kinds of ailments could harm them. And if they could be harmed, that might be a crime. And so the federal government, using its power through the criminal code, or its exclusive power to govern criminal law under Section 91(27), exercised that power and extended it out to include drugs and food, sort of thing. So that's how the federal government has jurisdiction over that. Because whenever a government has jurisdiction over something, it doesn't just happen, it has to be pursuant to something. Financial contributions to the national Medicare system through the public debt and property clause and its general taxing power, of course. And national health emergency is potentially through the peace, order, and good government power, although it hasn't been used recently. There was talk of it potentially being used during the pandemic, but it was never exercised, or has not yet been exercised, I should say, in that regard. So the overall structure: in general, healthcare in Canada is publicly funded but privately delivered. You all know that. This means that while the vast majority of healthcare services are free at the point of use, they are delivered by private providers, i.e. physician services. Free means when you're in a hospital, if a nurse gives you pain medication, she doesn't say to you first, "I need your credit card, and then I'll give you your pill." That's what we mean by free. in that context. Both administration and service delivery are highly decentralized, and administration is a mix of public and private. There are also significant inequities within the system, of course, most notably amongst Indigenous populations and some vulnerable groups. So I'm going to explore much of this in the remaining time that we have together. This kind of overall structure I just went through with you. So overall structure consists of governance and coverage. Governance and coverage. Here's governance. Why did I start with the Constitution? Well, look where it sits. It sits at the very top. Everything emanates from the Constitution, meaning everything emanates from that division of powers. Section 91, what the federal government has power over. Section 92, what the provinces have power over. So as you can see, this is how it all breaks down on the left-hand side from a federal perspective, on the right-hand side from a provincial perspective, and then you can see in the middle we have some national processes, meaning things where the federal government and the provinces share some of that. I'll talk a bit more about this just, again, as we go through this. That's governance. But then there's coverage. Coverage means services, funding, administration, and delivery at different layers, if you will. The first layer meaning where it's all publicly funded. What's all publicly funded? Generally speaking, all hospitals, physicians, diagnostics, that kind of thing. Out of public tax dollars, universal single payer system, private self-regulating professions, and generally speaking, you're talking about private, professional, for-profit, and not-for-profit facilities, a mix at arm's length. Layer 2 are what we call mixed services, combining some public funding and some private funding. Things like prescription drugs, home care, long-term care, mental health. That's a combination, if it's a mix, of course, of public taxation and private insurance or out of pocket. Public coverage is targeted, very targeted, and public regulation of private services as well. Private, professional, for-profit, and not-for-profit facilities still same as under our publicly funded layer. And then finally, we have what are called purely public services, or almost all purely public services, dental, vision, and that kind of thing. There are exceptions to this, of course, but generally speaking, for illustrative purposes, it's primarily funded either out of pocket or through private insurance with just some public taxation, private ownership, private professions, and then private professional for profit. Most people are making a profit that operate in this layer. The role of the federal government in healthcare is very clear: to assist in financing the provinces and the territory in their responsibility to deliver healthcare services through what are called fiscal transfers. They set standards and principles upon which transfers are contingent. They deliver healthcare services to specific groups, though, and they provide and fund other health-related functions. Money is the big stick that the federal government uses in the delivery of healthcare services. The federal government delivers very few healthcare services directly, but they influence the delivery of all healthcare services across the country through, again, fiscal transfers. Other functions include things like public health, which is shared, of course, as we know through the pandemic, federal, provincial, and local, health protection programs, health research, and that kind of thing. So here is some more detail from that governance graphic I showed you a moment ago. I'm not going to go into it in a lot of detail, just in the interest of time, but you've got a number of different federal agencies that are involved in healthcare. You can see some of them. This isn't all of them, but some of them listed on this slide. Now let's turn our attention as we draw to a close to one of the most misunderstood pieces of federal legislation I think ever enacted, and that is the Canada Health Act of 1984. The Canada Health Act does not entitle Canadians to healthcare services anywhere in the country, as I believe is often interpreted. Rather, the Canada Health Act is nothing more than an insurance plan. It's an insurance plan. That's it. It establishes the criteria and conditions related to what are called insured healthcare services, the national standards, through which provinces and territories must meet in order to receive the full federal cash transfer contribution. Historically, insured services are largely restricted to care delivered in hospitals and those by physicians. And because it's been restricted to services delivered in hospitals or by physicians, you can see that many of the clinical interventions and professional services that are now integral to our current healthcare system are not covered, i.e. medications and home care, to just name two. The Act states that the primary objective of Canadian healthcare policy is to protect, promote, and restore the physical and mental well-being of residents of Canada and to facilitate reasonable access to health services without financial or other barriers. So to do so, the Act lists a set of criteria and conditions that the provinces and territories must follow to receive their federal transfer payments. If they don't do these things, they don't get money, or they don't get the full complement of money. Also, largely unknown, there's also a requirement that the provinces ensure recognition of the federal payments and provide information to the federal government. That's in the legislation. It says in the Canada Health Act, you, provinces, in exchange for this money that we're going to give you, you have to tell everybody we gave it to you. It's in the legislation. The provinces and the territories play a different role, but the biggest role in terms of the delivery of healthcare services in Canada. They administer their health insurance plans, they plan and fund hospitals and other health facilities. They services provided by physicians and other health professionals are regulated at the provincial level. Planning and implementation of health promotion and health and public health initiatives, again, shared to some extent, and negotiations of fee schedules as well. Now, turning back to that coverage table I told you, let's just talk a little bit about the delivery of healthcare services. Again, it's a bit of repetition here, but I just want to make sure that we kind of understand that it can be divided into public, mixed, and private. Like I said, public, hospitals, mixed, things like prescription drugs, private, even though private doesn't always mean entirely private, things like dental and vision and that kind of thing. But delivery itself refers to the manner in which these services are organized, managed, and provided. Organized, managed, and provided. And so this is largely the system we have in terms of delivery in this country. And just a reminder, the healthcare industry is the second largest employer in Canada. Over 2 million people work in the healthcare industry from a delivery perspective. Key players in delivery, we already talked about this, the hospitals, the physician services, and prescription drugs. Other key players include nurses, pharmacists, other regulated health professionals, which we'll touch upon in a moment. Unregulated healthcare professionals include people like personal care workers. And of course, it also includes, we can't forget about devices, diagnostics, all the rest of it. This is all part of our modern healthcare system. In Ontario, we have 26 regulated health professions. Regulated actually means self-regulated. So each of these healthcare professionals has been given through provincial legislation the ability to regulate themselves. The province doesn't regulate doctors. Doctors regulate doctors. But doctors have been given that power, or physicians, I should say, have been given that power pursuant to provincial legislation. Not all provinces and territories regulate the same health professions in the same manner, but it's generally something along these lines. 2 more slides. I talked about delivery in a moment ago. I want to just conclude with financing. Healthcare financing refers to how medical services are paid for. In large measure, healthcare is financed through public funds, but that's evolved. That's our 70-30 split. So public, as I mentioned before, 70% of all healthcare expenditures that are made primarily by the provinces and the territories with some federal expenditures. private. This is insurance through your place of employment or insurance you purchase yourself, often used to supplement secondary or additional care. And then, of course, out of pocket, which is increasingly being used by those who have the means to use it to purchase additional care or supplementary care. And this is the final slide, again, referring back to that governance graph. You note some examples of what we call national health care bodies or roles, in which the federal, provincial, territorial governments share responsibility and funding as well, not just who does what, but who pays for what. So you've got things like the Canadian Agency for Drugs and Technologies in Health, funded in a very complex manner, but generally speaking, 70% by the provinces and territories, 30% by the federal government. You've got the Canadian Institute of Health Information, Canada Health Infoway. Again, these are joint, or what we call national efforts around healthcare in Canada. And that's it.
Well, thank you so much, Ryan. What a great overview of how the government works. You really made it so understandable. That was incredible. I'd love to open the floor up for questions. Does anyone, if you would like to ask a question live, you can raise your hand with the button on the bottom there, or if you'd prefer to type it in chat, please feel free to do that and we can read it out for you.
There is a question in chat from Colleen Hicks. What was the USA expenses versus Canada?
Yes, absolutely. So back on slide 28, the United States spends more on healthcare than any other country by far, as you'll recall, but the exact number looks like it's close to $11,000 per person. Yeah, close to $11,000. Now, the extraordinary thing about this is, for a healthcare system that is so focused on, private medicine, look at the percentage that's public. The vast majority of per capita health spending in the United States is public. That's Medicare, Medicaid, and Veterans Affairs, primarily, those three things. They are massive, massive social programs in the United States. So for all of the talk about, how private healthcare is in the US, and it is, look at the breakdown. It's even more so on a percentage basis than it is in Canada.
Okay, and I'm going to unmute Michelle Zielinski to ask a question.
Thanks so much, Ryan. Just really interesting stuff. I wonder if you could speak to, it's near and dear to our heart here at Bladder Cancer Canada, drug shortages, and where that whole conversation of drug shortages lies, with government and sense of responsibility when these things happen.
Unfortunately, that's not really the role that either level of government in this country has chosen to play, at least not actively inserting themselves into, again, what I'll call the private drug market. Sometimes they do, but not very often. So shortages can be a real challenge when they are manufacturer based. There's no question. Yeah, it's unfortunate.
Ryan, do you believe that the Canada Health Act will ever be amended to include things like medication and long-term care?
Yeah, that's a question a lot of people want to know. I think the short answer is no. I highly doubt that there's any interest in amending that federal piece of legislation. I know that the federal government has an interest in healthcare, but along with that interest goes funding. And so if they were to expand the Canada Health Act to include, say, medications, then that would immediately put an obligation on the federal government to be able to provide funding for the provinces to fulfill the commitment of that legislation. And so I think it's unlikely that you're going to see anything like that. I've never heard anybody talking about amending it. The other thing you have to understand too is that when you amend legislation, it opens up the entirety of the legislation and all that's in there. And there may be pieces of that legislation that nobody wants to ever open up again, at least not in the foreseeable future. So it creates a real challenge and tremendous inequities across the country. That's why I wanted to take the time to explain to you, because one of the most common questions I get is, I don't understand how I can live in Canada and we've got this thing called the Canada Health Act, we've got the federal government, but if I live in British Columbia, I can get this treatment, this intervention, this medication, but if I live in New Brunswick, I can't. I don't get it. Well, all you need to get is Section 92 of the Constitution. That's all you need to get. That says the delivery of healthcare, it doesn't say this exactly, but it's been come to mean the delivery of healthcare is almost the exclusive jurisdiction of the provinces. And the provinces are enshrined in the Constitution, so they can do whatever they want. And that's it. That's the short answer. All the federal government can do is push and pull these indirect levers, primarily through money, to compel provinces to do things. They can't do anything directly other than the very specialized services that we talked about.
Advocating to get a treatment approved for coverage for an approved drug, but that's not paid for by Nova Scotia for the treatment of bladder cancer.
Yeah, so it's a drug that's approved by Health Canada, but isn't reimbursed through the public formulary in Nova Scotia. Right? Is there a specific question around that?
How do you advocate
how
to
do
get
you,
the treatment
how do you
approved?
advocate?
Yes.
Okay, so that's so we're going to be talking about that actually in our upcoming webinars. I'm going to talk specifically about the drug approval and reimbursement processes in Canada. And then we're going to talk exactly about that. How do you advocate? What do you do in those circumstances? So I guess the answer is stay tuned. We'll talk about that in a whole lot of detail in the coming weeks. So hope everybody can join us. Yeah.
Great. Well, then that leads perfectly into another reminder. If you haven't registered for the next session in the series, please do so. Shasta's going to drop the link into the chat one more time. And if you have any questions or comments, feedback, please send them to info@bladdercancercanada.org. Thank you so much, Ryan. We really appreciate it. And we're really looking forward to the next session. So hopefully we'll see everyone on Monday night.
Thank you, everybody.